My name is Rami Farraj. I am an internist. I did my training at Imperial College in London, and then I did my residency program at the Mayo Clinic in Rochester, Minnesota. I originally was interested just in medicine, but the practice of medicine in the coming years following my graduation showed me that I really need to concentrate on how the system can be improved so that not just our medicine can help, but rather the whole system can effectively do much more. I was involved in a national program in Jordan to computerize healthcare. This is one of the pioneering programs, I think, in the world, where we're putting the whole electronic medical records of every person who lives in Jordan on a single platform. Now, I wanted to share with you today a very special thing, which is how the electronic medical records and its associated health technology solutions have affected us in the last year, especially during the pandemic years. I say years now because it's extending more. We thought it'd be only one, but now it's obviously going to be at least 3 to 5 years. As you know, Jordan was hit with the pandemic, and we all went into lockdown. Our hospitals were ready? No, they were not. None of the hospitals anywhere, I think, were ready. But luckily, we did a strict lockdown, which saved us getting a wave in 2020. And during that time, we got our act together. Many people started buying ventilators, ICU beds were developed so that they can be attached to any hospital. Field hospitals were being opened. And I think that happened in many countries. That's not very special, although the ICU part may be. But what I really wanted to talk to you about is the fact that the lockdown really changed our workflow completely, because as you know, most people started working from home, not much was being done, and we have a whole computerized health record system that needed to be run by more than 300 employees. So they had to work from home, and I think that's also common in many other places. But then we realized, well, hang on a minute, people still need treatment, people still need medicines, people still need to see their doctors. So we quickly had to change our workflow in a way, and we had to improvise with new health solutions to allow for that. So we did 3 initiatives during the pandemic years. First one is we started telemedicine, and this allowed us to see which people really needed urgent care, and they needed to see their doctors. You know, it's okay to not go to hospital, but for some people, but others, they really need to have that message from the doctor of what to do. But that solved only a part of the problem. There were people who still needed their medicines. And so we established with the Ministry of Health a process where you can at least get your refill prescriptions delivered to your home. This is not something that previously been done before, at least in Jordan. So we had a lot of volunteer help from the medical community. And luckily, we were able to establish a process where all refill medications can be delivered to the house of each patient whenever they wanted to. That really took the load off the system, and that allowed healthy people to not need to go to the hospital just to have their refills. And hospitals were full of corona these days, those days at least. So it saved us, I think, a lot of illness and heartaches. And the third one is, as things started to improve, we were able to establish a booking appointments for patients in the public sector. previously in Jordan, previous appointments, you have to go to the records area and get an appointment booked there. So we were able to establish online booking for appointments. And between the online booking, delivery of the drugs, and the telemedicine, we realized that 3 initiatives combined together really improve patient care beyond what we expected, especially the ones who used all 3 together. So this was just a personal experience that I felt is worth sharing with our colleagues across the world, because we didn't expect the effect of combination of all 3 initiatives to be summative. And I just wanted to share this experience with you. We looked at different solutions before we decided to go ahead with this initiative. First of all, I honestly believe that the medical record of the patient should not be with him. It should be ahead of him. Wherever you go, whether you are suddenly dizzy on a beach and you go to the resort there, maybe you're unconscious from hypoglycemia, I'd like my doctor to know that without me being there to tell him that. So that's the principle we started with, is that we need to have all the medical information available on servers, so that on a private, obviously, health server that would allow anyone in Jordan, wherever they go, to have the records accessible from any public hospital or even military hospital in Jordan. And that really gave us a lot of advantages. One of which is it stopped people from abusing the system, from medications being taken from a primary healthcare center and then someone prescribing it again from the hospital nearby and then going to the other hospital to get a different batch. And it also reduced the amount of duplications that we got from investigations that used to happen, or from records being lost, and people having to repeat a full evaluation because their record was lost. So many advantages happen, but when you have it all on a single platform, the advantages really become very impressive, because then you have a lot of data and you're starting to talk about big data. Now, during the pandemic, we have health data analytics that look at this raw live data of more than 7.5 million people. And we could make a lot of sense, and we were able to give the health stakeholders and the Minister of Health our expectations of, where things are getting bad, where they're not, what's happening regarding the COVID infection, and so on. So I think our predictive role in the beginning was very helpful to people to prepare what needed to be done and how to prepare for each area in Jordan. The quality assurance is very important. So initially, we made sure that we chose the CPRS VISTA system that is found in most of the VA hospitals in the US. It's an open source system, but we customized it to Jordan, and it is run by Jordanians here who learned how to run it. And it is, HIPAA compliant, and obviously there's a lot of committees that look into the quality of care and make sure that the system is robust and there's no gaps in the data. One of the beauty of that system is that any record that it goes there is there permanently. You cannot delete it, even if you want to as a physician. You can just say addendum written in error or whatever, but that record will always show. And that really is very helpful for whether it's a medical legal case, whether it's related to the rights of the doctor, the rights of the patients. So I think choosing the right system is really helpful. But avoiding integration between different systems is also something that I feel was an added advantage by having a single platform. If you have different systems, I know when the US tried to just combine the already computerized records together, it cost them almost 5 times as much as having the systems in And even with that, they couldn't integrate the whole data. In your hospital, you might say pain of the chest. In my hospital, I say chest pain. For the computer, it doesn't compute. We need a special software to say pain of the chest equals chest pain. And then someone else comes in and says, oh, I say angina. And then, oh my God, we still need the third system. So lots of gaps happened as a result of people using different systems. I think this is changing recently with international coding and international regulations that allow people to use the same language, but unfortunately not fast enough. This is why we felt it was easier to start with a single system. And I'm happy to say that it's now also used in other countries as well, which is really nice to see that. I think we already started to see how that has happened. The software already has things like allergy-drug interactions, drug-drug interactions. So alerts already come to the doctors. But the beauty of the system, it's also connected to the labs. So if you're going for X-ray, you have a high creatinine, it will not allow you to have the X-ray before an approval from a warning. The same thing would happen if you try to take different medications that were sometimes, someone in one state or one city would prescribe an antifungal for your foot infection, and then you go somewhere else and someone gives you an antibiotic and they interact together. If it's a different system, these can lead to sometimes people dying without us knowing why even. But now, luckily, this has been reduced significantly. But beyond that, when you start to talk about health data analytics, you start to get more reports that are beneficial to build policy on. As you mentioned, like the antibiotic map of Jordan, we can now see which bug in which city responds to which antibiotic. So there's no point in, first of all, wasting your time prescribing antibiotic that doesn't work. And also, there's no point in following an international guideline on how to treat, for example, urine infection with a certain antibiotic that will not work in your hometown. So it's nice we start to develop customized guidelines that really work in your own special city. And I think that was very helpful. Another way of helping with the health data analytics, we were able to see which doctors were prescribing out of the average. And sometimes that happened to be a good thing, and other times it was because they were prescribing for the wrong reasons. And we were able to spot the outliers just from health data analytics and improve healthcare in general for the patients who are being taken care of by these doctors. I still think most people still don't take a good psychological or mental history. It is sad to say that, especially when we know that at least 10, if not 30% of illnesses are somehow affected, if not started, from mental illness alone. So it's sad to see that this is still not getting enough support from the medical systems in the world, in a way. But I can say that one of the first hospitals in the private sector that accepted the VISTA system is actually a mental hospital in Jordan. It was the first hospital to start using this. And the reason why they wanted it is because it has the way to capture this type of data. And more importantly, when you connect it with the telehealth, which I think is slowly becoming the norm for mental health consultations, especially in our part of the world, where stigma still affects people going to psychiatrists and psychologists. It is sad to say that that's still in the 21st century, but unfortunately, it's true. And it probably is in a lot of places in Southeast Asia and most of the Arab world. I think when you put telehealth and you start to have consultations by psychiatrists and psychologists for people at their home and recording this data in the file, then you have captured two things. First, the psychological and mental history of the patient, but also this can be in the patient's record so that when they really have a psychosomatic illness or some other problem that is related to their, for example, drugs that they take for mental illness, the doctor who sees them next is aware of that, and he can talk about it. So I think this will definitely slowly break some of those stigmas, hopefully, that are around mental illness. We are, in fact, in discussion regarding this issue because in Jordan, like many other countries, first of all, the prescription is not mandatory to get your pills. It's probably only mandatory for specific addictive drugs that the ministry looks at. But unfortunately, you are able to get most antibiotics and most drugs without any prescription. And people usually, because of that, find it easier to just avoid the hassle of going to the doctor and the money to see a physician and just go to the pharmacist to get their medications. Now, pharmacists are very knowledgeable people, and sometimes they can easily solve the problem. But there's a medical legal issue here that is important to point out. And if something happens, the pharmacist would be at fault here. I think if you work on a national health insurance plan, that will ultimately resolve this issue. If you can go to the doctor for free or very little money, then most people, I think, would probably go. If it's easy to get a teleconsultation from a doctor on your phone on your way to the pharmacy and get a doctor's opinion, an official doctor's opinion who can give an e-prescription to the pharmacist to give you the medicine, that seems much more logical and safer to the patient, I think. This is why we worked on something called the Hakim claim, which essentially allows all the health insurances in Jordan to go through a single, like a post office box where all the information go through and before they go to the medical provider. And this allowed us to computerize the electronic health claim that goes to all private physicians. And this allowed the physicians to give e-prescriptions and e-orders to labs and radiology and other services. So with the telemedicine, I think we are coming to a point where the patient will easily, if he is insured, get a quick consultation from his doctor at his home, and he'll send him an SMS of his e-prescription. He can immediately go to the pharmacy and just give him the SMS code that he got, and he would get the prescription in a safe and controlled manner without having side effects from unknown medications and, as you said, drug-drug interactions, because it's not recorded into the system. I'm an internist, and so by nature, I'm more of a primary care physician than anything else. And it's sad to see how lifestyle modifications are frequently said to be, the first line of treatment for many diseases, but yet no one is really doing it. And when they do, it's just lip service where they say, oh, you have to, stop smoking, eat a healthy food and lose weight. And without really working on making sure that the patient has a proper guideline, at least, on how to live a healthy lifestyle. I think the primary care centers across the world needs to adopt healthy lifestyle as an integrative part of their service. They need to offer it in a professional and easily accessed approach to all their patients. And from that concept, we started working on first something called microclinics with the University of California, Berkeley. And we found out that if you have self-help groups and a physician talking to them or an expert, the response is higher. And then we thought, well, if the self-help groups on their own don't achieve much, but when there's a physician there, they achieve a lot. And diabetes control was much better with that. And we saw a drop in hemoglobin A1C just because of these sessions. So we decided to extend this further, and we made what we call the healthy community clinics, where we have like more than 15 to 20 topics that handle mainly chronic diseases and how they can be dealt with through lifestyle modifications and through healthy lifestyles within the clinic. Because as you know, even when the doctor says stop smoking, 10% do. So obviously we do have an impact on patients. So imagine how much of an impact we would have if we actually have a tobacco cessation program, if we have sessions where they can sit there and listen how they can make healthy food and how they can avoid the junk food that's hurting them. If they sit there and together they realize how to do exercise. We have exercise sessions now in the clinic. You know, we see the old ladies and old men, you know, and they're doing the stretches first, and then they go for the walks around the clinic. If there's, it doesn't need much to happen, but you teach people how to live a healthy lifestyle, and guess what? They do. They do. And their mental wellness also improves. That's why we extended even mental health sessions into that healthy community clinic. And surprise, surprise, mental illness was also improved. Many people were able to just get better from the group therapy that was formed, the feeling that there is a communion feeling that we're all in this together and we're all going to work together to make our lives better through lifestyle modification really works, especially in rural areas. You know, in the city, it's easier to hide, but if you are living in a small town and, you know, even if you are told by your doctor to attend a few sessions about blood pressure control, you might go one time and then you decide to skip the rest. When you will see the doctor in the next wedding or funeral or social gathering, and you're going to say, oh, I'm sorry, doc, you know, I missed it. I promise I'll go next week. That social pressure that's found in the small towns actually was very helpful in health style modification. You can actually get a sense of communion, even if you don't, even if the doctor's not there. Other patients who are with you in those sessions, they call you up and say, hey, you didn't come last week. You know, we missed you. Come this week. So this really helps, and it's nice to have, you know, if we're going to have social pressure, let's at least have it towards healthy things and not towards drugs and alcohol and tobaccos, you know. There's a lot of ambiguity and about stress, and I'm more evidence-based. You tell me that stress has been proven to do this or that, and there's studies to prove it, then we can work on that. And stress has been known to cause certain diseases, and I am more than comfortable in addressing the stress that is causing the disease. Sometimes the stress is not a cause, but rather an exacerbating factor. And that can also, you know, stress does not cause diabetes, but it makes the sugar worse, you know, and that's how people get diagnosed, because when the sugar is worse, they feel terrible, they go to the hospital. When they're stressed, and they told that they have diabetes, but they think, oh, I got it because I'm so stressed today. Well, no, you had it for a long time and just got exposed today because it went up so high because you were stressed. So there's a lot of ambiguity around, mental stress and its cause. It's nice this is where research really helps out. Obviously, it is an important factor in our daily lives. And it's very important to go down to the true evidence and try to look through it and find out what items do actually are caused, what diseases are caused by stress and which ones are not. Because I also see a lot of people covering a big portion of life and saying, oh, this is all stress related. Cancer is stress related. Heart disease, I only got it because I am stressed. And forget about my cholesterol, obesity, hypertension, diabetes, and smoking. I was just stressed. No, it's nice to, give it its true stature and at the same time, remove the ambiguity that we talked about. First of all, choose the specialty in medicine that you are passionate about, regardless of how many extra years it takes or how difficult the residency program is. The residency program, it could be 4 or 5, but you're going to spend 40, 50 years in that specialty. If you don't choose something that you're passionate about, you're just going to be mediocre in what you're doing. If you're passionate, you love what you do, you're going to excel wherever you go. And I truly believe that. I never thought that I will be talking about health IT, but when I was in medical school, even before when I was doing my A-levels, back in the 80s, computers were not big, but yet I felt a passion. I actually took a coding course, at the time, and it was very basic stuff, but I loved it since, and I couldn't take it out of me, So, life has a way of bringing you back to your passion. So even if you don't see it now, you will find a way to get to do the things that you want to do. So I say follow the passion, and a pandemic may come and last a few years, but it will not last a lifetime. I think it's important to think beyond pandemic times. I don't see this pandemic lasting a lifetime. Maybe others will come, but for now, I don't see this lasting beyond a few years. So I think we'll need to just move with the change and just follow the passion. An IT guy, obviously.